How's it going, guys? It is 4:19 a.m. Thursday, February 9th here in Japan. We have a difficult question for pathology for step 1, difficult question for pediatrics for 2CK. If you think this question's weird, don't take it up with me. It's on pediatrics form 7 for 2CK. Before we get started, please subscribe to my channel. I really appreciate it. Give the video a like, really appreciate it. Find me on Instagram at mehlman_medical, mehlman_medical, links down below. Find me on Telegram, links to Telegram group and channel are down below. Now start the clip. 6-year-old girl, she has a seizure. She also has a 3-week history of behavioral disturbances, personality change. Her right knee is swollen and painful. Hemoglobin 10 grams per deciliter. Should be 13 to 17.5 in non-menstruating females and males. 12 to 17.5 in menstruating females. White blood cells 3,500 should be 4 to 11,000. Platelets 50,000 should be 150 to 450,000. All 3 cell lines are down. Coombs test is positive. I'll talk about this as we move through the question. We have urinalysis showing blood and protein. Question wants to know the most likely diagnosis. So let's just whip through the answer choices here. Choice A, Beckwith-wiedemann syndrome, wrong fucking answer. Albeit asked on pediatrics forms. Okay, so you need to know that this is a Wilms tumor syndrome. So Wilms tumor, which is your pediatric renal tumor, which will generally present as a painless flank mass in a child aged 2 to 5. It can occur in isolation, just as a solitary insular Wilms tumor, and it can also occur as in a constellation with various syndromes, Beckwith-wiedemann being one of them. There's many genes involved you don't need to know. Okay, chromosome 11 you do need to know. Okay, it's pedantic. It's on the USMLE 2CK, but Beckwith-wiedemann, this is classically Wilms tumor, macrosomia, which means big baby, born over 4,000 grams. Hemihypertrophy, where for whatever fucking reason, one side of the body can be larger than the other. Neonatal hypoglycemia, macroglossia, omphalocele. So what they do on one of the pediatrics questions, very difficult. They don't even mention Wilms tumor. They just say a kid is born macrosomic, okay, greater than 4,000 grams. They say there's macroglossia, omphalocele, hemihypertrophy, and they just say, what else could be seen in this patient? Answer is hypoglycemia. Okay, not dramatic. I've had students guess it correctly, thinking it has something to do with a diabetic mom because macrosomia can be seen. So it's just a lucky guess, but that's actually Beckwith-wiedemann syndrome. In this case, wrong fucking answer. Choice B, denys-drash syndrome, wrong answer. Garbage diagnosis. Okay, back in the day when step 1 was numerical, all shooting for a 280, we memorized obscure recondite syndromes. Okay. Never fucking seen it assessed once. This is WT1. This is also a Wilms tumor syndrome where the child can also have pseudohermaphroditism, okay, gonadal dysgenesis. So it's just the combo of Wilms tumor and gonadal dysgenesis. Wrong fucking answer. Choice C, membranoproliferative glomerulonephritis, wrong answer. So this is going to be on USMLE classically hepatitis C plus blood in the urine. That simple. Okay, isn't it so amazing how simple things can be? So just blood in the urine in a patient who has hepatitis C. Can be sometimes malignancy. So it's a nephritic syndrome. That means blood in the urine. And you can get dense deposits, other nonsense findings in pathology, but membranoproliferative hepatitis C, just regular membranous hepatitis B. Wrong fucking answer. Choice D, SLE, correct answer. Now, as I prefaced with the start of this clip, not my fucking opinion if you think this is weird. So they give a kid on the pediatrics form, they actually give a 10-year-old, but you can absolutely have SLE under 10, I've seen it. So you say, well, what's going on with the seizure for starters? This is lupus cerebritis. Holy shit. Okay, so lupus can affect the CNS. You get transverse myelitis as another example of Brown's acquired syndrome. I didn't mention that here. Okay, I could have said there's Brown's acquired syndrome. That would have been even more of a what the fuck. Okay, so this is lupus cerebritis and arthritis. Okay, I mean, arthritis is the most common presenting feature in lupus, whether kids or adults. We didn't give a polyarthritis. We don't need to, okay, but we have our arthritis here. And then you say, well, what's with all the cell lines being down? Well, I'll tell you. Now, in lupus, it's exceedingly high yield. You know that they can get antibodies against platelets in particular. Okay, so you can get an isolated thrombocytopenia that tends to be most common, but you can get antibodies against your other hematologic cell lines. This looks like an aplastic anemia where all 3 cell lines are down. It looks like deficient bone marrow production, but it's not. And it's asked on one of the 2CK questions where they give you all 3 cell lines down in lupus. They say why, deficient bone marrow production, wrong fucking answer. It's increased peripheral destruction, okay, due to antibodies. Now the Coombs test here lays credence to that. I mean, that's the implication here. We're telling you we have antibodies against RBCs. That's what a Coombs test means. It just means we have antibodies against RBCs. Okay, obviously you could have anemia of chronic disease as well, but we're just pushing on you that we've got antibodies. And that facilitates the diagnosis if you have confusion. And then we just have lupus nephritis as well, which is diffuse proliferative glomerulonephritis almost always. Okay, some astute students might say, OMG, can it be membranous? Not really. Okay, I mean, textbook stuff, it's garbage. Okay, diffuse proliferative glomerulonephritis, that's going to be what we see in lupus nephritic syndrome. Membranous is nephrotic as well. You wouldn't get blood in the urine. So real quick, wagr syndrome, wrong fucking answer. This is another Wilms tumor syndrome. So this is WT1 gene. W, Wilms tumor, aniridia, which means absent iris. Okay, so you can get abnormalities of the irides, okay, plural for iris, fancy word. Genitourinary abnormalities, retardation. Okay, that's what wagr syndrome is. This shows up on pediatrics forms as well. Wrong fucking answer. You know the deal. I'm going to make more content. If you like my stuff, subscribe my channel. And I appreciate your time. That's it.